live with Dr. Jenn. I am excited to start this series. I thought about this for a while, but I thought now is the perfect time to start. So, with the cooler weather, snuggling up with my coffee here this morning. So, my thought was with this series was to really give people an opportunity to, I can address questions live, but really my goal is always to bridge the gap between, wellness, science, and joy. And there is a lot of information out there, and a lot of times it's really hard to sort through it. So I always try to cut through the noise, make it simple, but also make it accessible for everybody because I find that sometimes the wellness recommendations or lifestyle recommendations sometimes seem really hard to implement, and people don't know where to start or which thing to believe. So my goal is really again to make it simple. This live series is really for everybody. My main focus is women in midlife because that is who I am and who I deal with often. And it's, so many things happening in our bodies like they were in adolescence again before. So I love helping people clear that up. But it's also going to talk about, I'll also talk about family health because I am a pediatrician and I spend a lot of time coaching families on how to implement these healthy lifestyle changes. Also about plant-based living because I am plant-based and I think that is one of the most powerful things that you can do for your health and just everyday wellness, as it comes up. And if there is something amongst those topics that you would like me to focus on, feel free to drop it in the comments and, I'll make it a topic for the next or one of the future lives. So today, though, I'm going to talk about women in midlife, specifically metabolic health, which is something that often we struggle with because of all these changes. So a little bit about lifestyle medicine first. I am a pediatrician, pediatric intensive care. Actually, I practiced intensive care for 20 years. But over the course of that time, I became plant-based myself. And when I became plant-based, this whole new world was opened up to me. I learned about how powerful nutrition can be to actually reverse disease, not just treat disease, but actually reverse disease. And of course, prevent disease. And I was surprised that I had never learned about this before in medical school. And it opened my eyes to this specialty called lifestyle medicine. And lifestyle medicine is an evidence-based medical specialty. So it's not alternative medicine. It's not outside of medicine. It's within medicine. And it's ultimately what we should all be practicing. But with current times, modern medicine, it's hard with the time constraints. So what is lifestyle medicine? It focuses on six main pillars: plant-forward nutrition, movement, restorative sleep, stress management and mindfulness, avoidance of toxins and risky substances, human connection, is really important. And I like to add the seventh pillar of joy because joy, I think, is central to all of those, but also central to our health in general. And really tapping into that as one of the pillars is important because I think it's equally as important as the other ones. Um, so I mentioned that I'm triple board certified in pediatrics, pediatric critical care, and lifestyle medicine. But I'm also certified in plant-based nutrition and culinary coaching. I love to eat. I love to eat out. I love to travel. So often when I talk to people or people are thinking about making a change, one of the things that holds them back is, oh, well, I'm going away on vacation. Or, I really like to eat out. I like family events. Well, I like making those things doable and accessible because there is no reason why your healthy lifestyle is different from your fun lifestyle, right? It should be fun and enjoyable. So making healthy food or nutritious food more flavorful and tasty is really what I love to do as well. So let's get into the topic of metabolism in midlife. So what is going on in midlife with women? So there's so many hormonal changes and it literally affects every organ in our body when you think about it. Everything from our brain to our muscles to our bone health to our digestive tract. And all of these things have an effect on how we process food. And that is what metabolism is, right? It's basically how we process the food that we ingest and how our body deals with it, whether it uses it efficiently or whether it uses it inefficiently. So several things happen in midlife that throw this off. And one of the things is that everything slows down. So our metabolism slows down because we have less muscle mass. That's one thing. Muscle is one of the things that burns a lot of calories. And so when we use fewer calories through muscle at rest, then at rest, we tend to gain weight. Another big thing that happens is our digestive tract changes. So the digestive tract is not as efficient with absorbing nutrients. and our gut health changes. It slows down. Sometimes we have like gas and bloating and food intolerances that we didn't have before. And when we're inefficient in absorbing nutrients, our body sees this as being starved because our body is always trying to reach homeostasis, right? It's always trying to reach balance. So if it's not getting those nutrients in, it's like trying to grab that from whatever's going through your digestive tract and hold on to things more. So that's another thing. The other thing is that our with our hormonal changes, our body tries to compensate with that as well. So one of the things that happens is our estrogen goes down. When our estrogen goes down, our body makes estrogen in other places, the fat cells, and the fat tends to concentrate around our mid abdomen. When this happens, this puts us at risk for other problems like insulin resistance. And insulin resistance is when our body has enough insulin, but it seems like it doesn't have enough insulin because it's not using it properly. And when this happens, glucose circulates and it sets up a whole nother cascade. But insulin levels rise to try to compensate because that glucose isn't getting into the cell where it wants to be. And it signals our brain that things are not right. So it causes cravings. It causes our body to hold on to fat more. That's what that elevated insulin does. And it just causes this cascade to worsen over time unless we stop it, which leads to things like prediabetes, then diabetes, and the sequela related to that. It also can affect, again, every other organ in our body as well. You know, we see it in our bone health, we see it in our brain with that brain fog, which the thing is that these pillars also can help or make things worse. So we talk about midlife weight gain, often the solutions that were given or recommended, which literally makes me crazy with anybody, is to eat less and move more. And when you think about the things that I just told you, well, so maybe moving more is going to help a little bit, but it's not going to solve everything. Yes, we do need to maintain our muscles, bulk, muscle strength, but it is not the only thing, right? So we actually need to eat better, eat foods that are more nourishing. Sometimes we need to eat more. I was actually talking to two of my patients this week who were struggling with brain fog. Were struggling with not losing weight or gaining weight. And when we looked at what they were eating, it was very minimal. The focus is on protein, but all of those other nutrients. So protein is only one macro. And when we look at solely one macro, we were missing out on so many other things. Our body needs many things to function. And it is, I find the human body amazing. And it is incredible that it's always trying to, again, create homeostasis. Um, and it is always trying to compensate, but it needs fuel to do this. So it needs vitamins and minerals and nutrients and antioxidants, and it needs fiber. And when we look at solely one macro, we're missing out on all of those other things that are important. So I like to look at it as food as opposed to a macro or a calorie. And that's a really important distinction, different than I think a lot of people talk about. And so, with these women that I met with this week, one of them was getting her protein goals. But when we looked at everything else, in fact, her labs demonstrated she had deficiency in several vitamins. And when you looked at the calories that she was taking in based on what her activity level was not really enough. And so that can contribute to brain fog because I didn't mention, but our brain actually has our highest metabolic rate. It needs the most nutrients, right? So when we are starving our bodies to reach a weight, we're actually starving our brains as well. And that's really important when you look at long-term health. So it also just feeds those cravings. So I say that when we focus on dieting and one specific goal, like to lose weight, we're missing out again on the whole picture. And I like to focus on how you can nourish your body better. And when you do that, when you provide your body with all of the nutrients, you actually will lose weight because your body is able to relax and has the nutrients that it needs, and it improves your metabolism actually, and again helps you you know use nutrients more efficiently. So instead of focusing on the weight as the goal, focusing on nourishing your body with whole unprocessed foods and really looking at the quality of the foods that you're consuming can go a long way to improving your metabolism by improving your gut health, improving how your digestive tract functions, improving your insulin sensitivity so that your body uses insulin in a better way. When we focus on phytoestrogen rich foods and fiber full foods, it actually also helps stabilize your hormone levels. So again, helping that um, extra fat that is being stimulated to help with your estrogen production. So, while increasing the quality of your food. So, the other six pillars are also important when we talk about metabolic weight and metabolic health in midlife. So, movement. So, I always go with gentle movement, joyful movement. It should be something that you enjoy to do, something that you're going to do on a regular basis. And so, instead of going for the intense workout, unless that's what you love. I mean, I love to run, but I also noticed that when I was going through perimenopause and menopause, I was a little more fatigued. So that intense training that I used to do in the past wasn't as well tolerated because I needed more sleep and I just needed to, change it up a little bit, which didn't mean that I wasn't able to accomplish my goals. It just meant that I was listening to my body in a better, in a listening to my body more about what it needed. And when I did that, I actually was better at reaching those goals. So it is really important, I would say, to find movement that you enjoy and start small. Often in this time in life, we're juggling many things: our children, our careers, sometimes our parents as well, and so many things. And unfortunately, our exercise routines may get thrown off, or maybe we never had an exercise routine. So I always say a 10-minute walk is better than not doing anything, and you can build on that. So it's the key is with lifestyle medicine in general is finding those small consistent steps that you can do and repeat, and that's where the change and the power lies in actually creating a sustainable change and continuing it for the long term. And getting, when you think that affects snowballs over time, that 10-minute walk may not seem like much, but a 10-minute walk every day, it's a game changer. You put that 10-minute walk after your meal, and that improves your insulin sensitivity. It improves your digestion, it improves your mood, and it improves your sleep. So, sleep is the next thing I talk about. Sleep is another thing that we often, say, oh, I'll catch up on it later. But our body keeps score. That is one more stressor that our body is exposed to. So many important processes happen while we sleep. And when we diminish our sleep, it can worsen this metabolic weight, this midlife weight gain, and worsen our metabolism in midlife. It can worsen insulin resistance. It elevates our cortisol levels, which again works towards elevating our glucose, which makes the problem even worse. So prioritizing sleep is really important. Stress and mindfulness. I cannot say enough about this. I actually, when I talk to my patients, there are two things I tell them first is increase your fiber in your diet and manage your stress, because we don't think about how much our bodies are stressed on a regular basis. Even if you go through life and you think that you're relatively low stress, we are connected all of the time. We're not meant to be connected all the time. I'm on my cell phone right now and I have my computer next to me. So our bodies are not meant to respond to these kinds of cues all the time. Our bodies are literally, we're animals. We're meant to live in nature. We're meant to respond to the daylight. We're meant to respond to the nature around us, the sounds, the sights of nature. And so when we spend our whole lives connected, even if you feel like you have a relatively low stress life, I think it's something that you're missing out on. So I always recommend adopting some kind of mindfulness practice. And it doesn't have to be an hour of meditation. It doesn't have to be meditation at all. It could be simply a walk in nature. It could be some deep breaths, but doing it regularly on a regular basis is really important for resetting your nervous system and bringing you present in your body, which is another really important thing for health overall. It is important to have a way to manage stress, and managing stress may take many forms. Removing the stressors that you can from your life is really important, but again, tapping into that mindfulness is equally as important, or maybe even more important. So I talked about sleep, nutrition, sleep, stress, movement. The other things are toxins and risky substances. So there are many environmental toxins that, the way that I address that is I limit what I use as much as possible, and that's the best way to start. But also things that you ingest yourself. So alcohol can make your metabolism worse. It can worsen weight gain. It's a high calorie item, and it causes inflammation, which again I didn't talk about, but that's another component of this midlife weight gain. And then connection. We are social beings, so we are meant to connect. So making sure that you're spending some time, connecting on a regular basis, intentional connection, because often, our connections are fleeting. It's a quick text here or there, or a phone call here or there, but really scheduling that time in to spend some quality time with friends and family is important. So those are the 6 pillars. And then joy, I always like to say joy snacks throughout the day. So thinking about, like, one of my favorite joy snacks is my first thing in the morning. I use it as a mindful moment, but also as a little bit of joy. I love enjoying my coffee fully. I, enjoy grinding the beans, the whole ritual of making the coffee, but then I enjoy holding the coffee cup and smelling the coffee. It's that a full body experience of my morning coffee. So just having moments like that bring you pure joy for no reason is really important. Another way to harness that, which also connects with helping your sleep, is it's a great tip, is before bedtime, thinking about what was the best thing that happened over the course of the day. And that makes you focus on the good. And when you go to sleep with those good thoughts in your brain, it really does make a big difference with helping calm your brain and stimulate those happy hormones. So that's my joy tip for today. Hopefully that was helpful. So overall, again, midlife weight gain is multifactorial. And when we focus on just 2 things, eat less and move more, as a way to manage midlife weight, we're obviously missing out on a lot. And so I didn't talk about hormone replacement, but that obviously is something to discuss with your healthcare provider. I think that yeah, that's a personal decision that you should address with your healthcare provider. But overall, these are the things that I help women with in my midlife metabolic reset, which I'm talking about this week, because I have lowered the price for this week, because I want people, as I mentioned, I think lifestyle and joy life should be intermingled. And I think often as we enter the holidays, we think, oh, I'll start next year. But I want to encourage people to start now, start today. There's no reason to put it off until next year. So I will say that the women in my program now have said a couple things to me that really brought me joy, was that they finally felt heard. So that constant refrain of eat less, move more, again and again and again, wears you down. I think that I think, number one, you should be that health comes in all sizes, number one, and that we don't respect the change that happens in female bodies. Our bodies are changing every day. We have hormonal changes all of the time. So to expect our bodies to stay the same as we go through these major hormonal shifts is really, not fair and unrealistic. So that is one of the most important things that I want people to leave with, is that, this is a challenging time in life because so many things are changing, but it's even made more challenging by modern society and this thought that we should stay the same all the time. So I encourage you that if you are a woman in midlife, to just take a pause and think about, all of the things that your body has done to you, and how you can reconcile the changes that are happening, and maybe pause and take some time to be more present and be more appreciative of the body that you have, and respect that nature takes time. And while things sometimes seem like they are, everything is changing, and you might feel like you're very under out of control, that actually you know nature again takes time, and everything will balance out again in the end, which I know sometimes it's hard, but it's just something to think about, slowing down. So my midlife metabolic reset is it is decreased price. I lowered the price by $500 this week, and that lower price is going to last until well, we'll see how long it lasts, but it's for now. I have spaces for 5 more women to join me, and for this month. I didn't mention, okay, so I talked about lifestyle medicine. I talked about, oh, I'm going really long. I'll just mention that I do have this idea when I talk about nature and I talk about lifestyle change, that nature takes time, and that's often where people get hung up when you're making a lifestyle change, because the things don't happen fast enough. And I will say that, again, it takes time. Nature takes time. So when we're talking about lifestyle change, we're talking about improving your gut health, your metabolism, decreasing inflammation, and so many different things that, when you think about it, it's not going to happen in a day. And we allow these changes to happen, we're looking at lifelong health, and it helps. When I work with patients, I usually choose one thing to focus on. But when we focus on one goal, that goal and this lifestyle has a ripple effect on so many other goals. So it's just something to think about. I'll say that I follow this plants framework when I'm talking about lifestyle change, that it has to be personal. You have to have a reason to make the change that means something to you. It can't just be because my family said or my physician said. It has to be really something that means something to you. You have to learn. I think it's so important to understand why things are happening, understand your labs, understand your lifestyle and its effect on your labs, understand the changes that you're making and how they're going to have an effect, and to act. So not just to learn, but to put those things into action, and then to nurture it and feel how it feels in your body and make adjustments along the way. And over time, it will become second nature. And that's a matter of making your environment change so that it supports this new lifestyle, but also just feeling more comfortable in it. So the decisions become second nature. And that's where the transformation occurs. And then ultimately, once you've transformed and you're feeling really good, you want to teach and share it with somebody other, then you become a steward. So that's my plants framework for lifestyle change. So I think I mentioned kind of working with me. I work with people. I have my Joyful Metabolic Reset, which is the program I talked to you about, which helps with weight loss and prediabetes and diabetes and reversing diabetes. Many people have been able to come off medication or avoid medication, and that's that 12-week program that I have discounted this week. But other things, I help families. Again, I talk about this every day in my urgent care. Probably I talk about nutrition and lifestyle with families, because that is something that we struggle with a lot these days. There's so many, again, like I started at the beginning of this talk, about all of the information that's out there, but a lot of it, there's some misinformation out there, and sometimes it's hard to sort through all the noise. So really sorting that through that noise and making meaningful steps that make a difference with your health and your family's health is what I help people do. So everything from asthma to eczema to pediatric weight to type 2 diabetes and prediabetes. So that is what I do. If you'd like to work with me, you can always book a discovery call. If you're interested in joining the Joyful Metabolic Reset, as I mentioned, it's a lower price this week. So click the link below and you can check that out. But if you follow along, maybe you're not ready yet to make a change, but I post a lot about all kinds of lifestyle related information here on this channel. And every Friday morning at 9 a.m., I'm going to be here talking about everything from midlife metabolism to plant-based nutrition to joyful wellness. So if there's a topic you'd like to hear, I encourage you to comment on this post or, send me a message. Again, if you are looking for a change, book a free discovery call and you can see how you can work with me. So thank you so much for joining me today. It's the first in the series of many, Friday mornings at 9 a.m. See you here. Okay.